Okay. Calling all men, it's time to get moving. So my name is Justin Kelsey. I'm the program manager for employee wellness with the Center for Community Health and Prevention. I'm also an American College of Sports Medicine certified personal trainer. I'm here today with the Got Health series. We're recognizing June as National Men's Health Month and to talk about exercise motivation and getting moving, especially for us guys. And so as this title suggests, the presentation is not specific actually to guys. The recommendations and tips and tricks that we'll talk about throughout this presentation are certainly applicable to all. So I do teach a number of physical activity and health education courses. And one of the most common barriers to exercise that my male participants describe is a lack of motivation. And I know, often that happens to myself as well. So let's dive into that just a little bit. So what is motivation? Motivation is what explains why people initiate, continue, or terminate a behavior at a particular time. And so there are two major forms of motivation. There is intrinsic motivation and extrinsic motivation. And we all have a combination of both in every decision that we make. However, internal motivation has been shown to be a little bit more effective, or intrinsic motivation rather, from a sustainability perspective. So the ability to be motivated longer term. And so external or extrinsic motivation looks like things like reaching a certain weight or a certain appearance, fitting into certain clothing, whereas intrinsic motivation is things like longevity or wanting to be around for kids and grandkids, the ability to, get down on the floor and play with them and, have our functional movement abilities and maybe not getting out of breath, things like that are intrinsic motivators for change. But even one instance, as I had mentioned, all of our decisions have a combination of both. One instance could have both. So for example, running a 5K or walking a 5K race to prove to yourself that you can do it is an example of intrinsic motivation. Whereas running or walking a 5K race to prove to others that you can do it is extrinsic motivation. But like I said, one is not necessarily better than the other. Just know that it increases your chances of sticking with an exercise program if you're a beginner exerciser or new to exercise or just coming back after a long kind of hiatus. It is more effective to find and attach as much intrinsic motivation for change to your goals as possible. So really sit down before starting an exercise program and ask yourself, why do I really want to be more physically active? Take some time to digest that, be honest with yourself and think about all of those things as you get going. But what is the myth of motivation? So we did, as I mentioned, leveraging our intrinsic motivation assists us in getting started. So intrinsic motivation refers to the spontaneous tendency to seek out novelty and challenges. And so there is a chemical response that our body engages in when we go through these novelty experiences or try things new. And it's across large scale neural networks that the response is increased dopamine firing. So we feel good when we try new things or when we have these challenges. But what happens when the novelty wears off? Or better put, what happens when our motivation wanes, right? So unfortunately, as humans, we are not inherently motivated 24/7, 365 days a year, though I wish that were certainly the case. Our motivation within a period of an hour, a day, a week is very much so like this and not very linear. And so we need to use our motivation when we have it. It's our powerful resource for initiating behavior. But it's often fleeting. So we want to capture that motivation and use it to get the ball rolling. But to keep the ball rolling and maintain momentum as far as our physical activity goals, that's when we want to start thinking about switching over from motivation to building and utilizing healthy habits. So while motivation is our powerful resource for initiation, habit is our powerful resource for sustaining behavior, especially when it comes to exercise. So there is a three-step process to habit forming that we'll talk about, but the benefits of forming habits is that they decrease our cognitive demand and stress. They increase our consistency in our daily lives and our decision-making, and they don't leave a lot of room for deviation. And I'll talk about that a little bit as well. But creating habits is essentially your brain's way of taking shortcuts. It allows our brain to shut off for a moment, so to speak. The example that I like to give is if you drive the same way to work every day, it becomes less of a series of conscious decisions and choices, and more of an automated habitual response. You end up getting to work and not really knowing how you got there, right? The habit loop takes over. And so certainly not suggesting you shut your brain off completely while driving to work. That would not be so good. But you can see how taking the thinking out of certain actions creates less of that cognitive demand and subsequently creates less stress, which is another very common barrier to physical activity. And it doesn't allow us time to deviate from that activity. And so how many of us in the past have made plans to exercise and talked ourselves out of it, right? That's very common. We can talk ourselves right out of, engaging in a particular activity. But that's because we look at exercise as a conscious decision or choice. Imagine if we reframed exercise as a habit or just another necessary part of the day, like driving to work. And so the three-step process is really creating a repeatable cue, initiating a routine that's enjoyable. That's very important for exercise. So I like to lift weights quite often. I like to walk my dog. But if someone were to tell me that, the best exercise prescription for me would be to walk on the treadmill for an hour a day every day, I'm really not going to enjoy that all that much. So I'm very much less likely to stick with that. So make sure whatever routine you're creating for your exercise is enjoyable, and then you receive a reward, which we'll go over. So this is just quickly the cue, routine, reward loop that we're hoping to create with our exercise to build it and make it more of a habit and less of a choice during the day. And so I will give another example. So how does it work for exercise? So much like the activity of daily living example, like driving to work, where our cue is the alarm going off, our routine is driving to work, and our reward for some of us is that we get to work that day. All right, so another example, an ADL example, is using the bathroom. That's your cue. Your routine, hopefully, is washing your hands, and your reward is illness prevention. So for exercise, how does this work? Well, it works very much in the same way. Only thing that we need to be responsible for is creating the cue. And so our cue that we create is something like, in this example, placing our exercise sneakers or clothes by the door or in a high visibility area. So we see them when we first wake up. We see them before we leave the house. And that's going to be our cue. And then our routine, if we like to walk outside, something like that, is to walk 1 mile, right? Or whatever is attainable for you. And we'll talk about attainability. And then your reward, of course, for exercising is lower risk for all-cause mortality, and is lowering your risk for developing many other chronic illnesses and conditions. So certainly things that we want to think about. But before we can create some of these healthy habits, we really have to specifically define our goals for exercise. And so you want to use that SMART approach: specific, measurable, attainable, relevant, and time-based. So there is consider a case scenario that one day you're taking the flight of stairs at work rather than the elevator, and after a few flights, you find you are out of breath. You say to yourself, I need to do more cardio. This is probably a relatively arbitrary goal that we have here, and we're less likely to be successful with a goal like this. So we may want to consider, rather than I need to do more cardio, something that meets these criteria: specific, measurable, attainable, relevant, and time-based. Something to the effect of, starting Sunday, I will walk 1/2 mile on 3 of the next 7 days. After 2 weeks like this, if my body allows, I will increase to 1 mile 3 times per week. It's very specific. It gives us a reflective period and a time to assess how our body's reacting, so it's attainable for us, and it's relevant to our health goals. I talked a little bit about stress and certainly a lack of motivation as common barriers and demotivators for exercise, but a lot of the other ones that we hear are time, weather, living in Rochester, injury, and comparing ourselves to others. So I want to touch on those quickly as well. So in a perfect world, there would be no setbacks, but we know that there are always barriers to our exercise. So for time, I like to think of it in the context of plot or perceived lack of time. The CDC's recommendation and the ADA's recommendation for physical activity is 150 minutes of moderate physical activity per week. And so really, if you break that down, that's about 21 minutes per day, or we'll say 20, and you can even chunk that into 2 10-minute bouts. And for the busy working individual, chunking your exercise can help us really fit it into our day a little bit easier. So something to consider. In terms of weather, it's always great to have contingency plans for your exercise program. So to go back to that walking a mile or a half-mile goal there, we can say, okay, we're going to have a contingency plan that on days where the weather is inclement, instead of walking outside, if I don't have a treadmill or the ability to really track how far I'm walking inside, I will at least make a tertiary goal to get 10,000 steps that day. And then go back to my walking goal in the future when the weather becomes nice again. So making sure you have contingency plans can be very important in helping you stay on track. In terms of injury, one of the biggest things that you can do is practice positive thought replacement. And so if you're injured and you're thinking, gee, I'm going to lose all of my progress, really start to think about things that you can do rather than the things that you can't do. So if you're injured in the lower body, you may want to think about some things that you can do in your upper body to keep burning some calories, to keep moving, and to keep doing some things that you enjoy to keep you in a positive frame of mind. And then comparing ourselves to others, certainly, really, you only want to compare yourself to how you were the day before. And I know that sounds cliche, but when we talk about exercise, we want to look at it in small increments, and we want to just be doing a little bit better each day. So try not to compare yourselves to others. That's going to bring on some more of that negativity that is not helpful for us in regard to getting more physically active. So I just wanted to give you a summation here of exercise motivation. So you want to certainly identify your internal and external motivations for change. You want to use motivation to initiate and try to find meaningful intrinsic motivation to connect to your goal. You want to really think about making exercise a habit versus making exercise a conscious choice. So create that cue, that routine, and that response loop. And then you want to clearly define what are your goals for physical activity, and then know that some of the ways that you can overcome some of the common barriers are to chunk your exercise into smaller bouts, create contingency plans for when things go wrong, because things will go wrong, practice positive thought replacement, and only compare yourself to your prior self. So there are some other tips for sticking with an exercise program. Track. So anytime you have the ability to, if you like paper and pen, to write down, when you've exercised, what muscle groups, however much detail you want, or even simply you have a calendar and you want to X off or put a smiley face on the days that you did your physical activity. That's great too, but some form of tracking is going to help with accountability. And there's a lot of great apps and online resources as well to help you track your fitness. And then engage your support system. So for me, my support system has 4 legs. As I mentioned, I like to walk my dog as well, but engage those around you in your health goals to help you be more successful. Reward your milestones, and then just make your exercise fun. And so thank you for sticking with me to the end here. I hope this was helpful for you, and thank you.